Given that global trend and with the 10 million case milestone on the horizon, as we've said, expected to hit that level in just a day or so, we thought it would be very appropriate to bring back Dr. Christopher Labos, who's in Montreal, an epidemiologist and cardiologist. And I know we had you in on Monday of this week, Dr. Labos, but given what is going on globally, nearly 10 million cases, growing at a rate of about 1 million a week, we heard from the WHO yesterday, and the speed at which that growth is accelerating, can you give me a perspective on that?
Yeah, I mean, so we often look at the situation in Canada or in our particular province and we see things are getting better and we might think that things are fine. But we forget there's a whole world out there, and there are many countries that are having outbreaks right now. The other thing to remember is that a lot of these countries, especially when you look at countries in the Southern Hemisphere, in South America, Brazil, don't forget, we're entering summer, but they're entering winter. This is winter for them. So if coronavirus still behaves as most respiratory viruses do, which is they have these peaks in the winter and then they trail off in the summer, yes, we're having the tail end of our first wave, but for many other countries, their first wave is first beginning. So from the global perspective, coronavirus has not gone away. It's still going strong. And we're seeing more and more cases. So, and then people ask, well, how does this affect us in Canada? Well, it affects us in Canada if people are starting to plan their summer vacation. So if anybody still has plans to go and travel abroad, I think the thing you have to remember that depending on where you're going to, you may end up finding yourself traveling to a country that has a lot of COVID-19 cases. So we have to remember that the situation across the globe is still pretty severe, and this has not gone away, and it's probably not going to go away for some time yet.
Yes, that's we have to keep getting our heads around that. It's not going to go away for months and months. That seems clear. When the WHO was laying out those numbers, it also warned about a shortage globally of oxygen concentrators. And I wondered, we've talked a lot about ventilators, Dr. Labos, but what are oxygen concentrators, and how worrisome is it that we don't have enough of those?
Well, I mean, it's worrisome in this, that what you see was a lot of these people who present with coronavirus, with COVID-19, the main problem with people who have the pulmonary manifestations is that they lack oxygen in their blood. And so that's the problem. So a lot of these people, even ones who don't have to be intubated, have to stay on oxygen. And that's why the number of people in hospital was so high, and a lot of these people have to stay on oxygen for potentially weeks, and that's part of the problem with the burden that this disease puts on the medical systems. That a lot of these people might be relatively okay, but they need stuff that we can only give to them in hospital. So if you don't have the mechanisms, you don't have the tools in place to give people oxygen, a lot of these people might actually die. And so, when people always ask, like, well, how bad is this disease? Can't we cope with it? The real danger is that if a lot of people flood into the hospital and you do not have enough equipment to take care of them, whether it's gloves, whether it's masks, whether it's visors, whether it's N95 respirators, whether it's intubators, or whether it's just the simple ability to give them oxygen, a lot of them, very well may die. And we saw that was happening in Italy and to a certain extent in New York as well. There was just no space for a lot of these people. And if you couldn't get them hooked up to the appropriate equipment, couldn't get them the oxygen they needed, that's where you saw a lot of deaths, especially when the healthcare system gets overwhelmed. So, we have to make sure that if there's when a second wave comes, that we do have appropriate stockpiles of all the necessary equipment.
When you reference hospitals overwhelmed, it seems amazing, but there are hospitals in the United States that are talking about potentially being overwhelmed again. We look to the U.S. as the global hotspot, and we're seeing in more than 24 of those states increases. They had yesterday the highest one-day total in the coronavirus since April. Does it seem that all the progress that's been made there has been wiped out? Are we right back in the beginning in some of the United States?
In certain parts of it, yeah, it certainly looks that way. I mean, and this is the consequences of reopening too early, of, reopening before you get things under control. So, as we reopen now, we have to be mindful of the fact that if we start to see cases go up, it may become necessary to lock things down, at least partially or completely again, depending on the situation. It becomes problematic. And while I completely understand the argument in terms of supporting the economy, and while I completely understand that people are frustrated with lockdowns and want to be able to live their lives, we have to remember that the consequences of this are essentially that if you open too early, if people do not stay home when the virus is circulating widely and easily in the community, this is what happens. A lot of people get sick. And while the vast majority of them, if they're young and healthy, are going to be fine, a certain percentage do end up in the hospital. And it's not going to take much to overwhelm the hospital system. Our hospital systems, especially here in Canada, operate at near capacity most of the time. So it's only going to take a very small increase in the number of patients to make things very, very difficult here.
Okay, so here's something I've been thinking about for the past few days. Reaction within healthcare professionals. When COVID-19 arrived, they were, you've been heroic throughout, but you put your lives on the line, doing whatever it took to help us through what was new and frightening and, deadly. And, somebody told me, I remember in the early stages, didn't have enough PPE. I don't want to be a martyr. That was then, when we didn't know what coronavirus is and when we didn't understand fully how we could slow its spread or stop it. Now we do, and people are just ignoring that, and they're still doing things that are having the numbers go way up in parts of the world. What do you think? And they're going to have healthcare workers putting their lives on the line again because people are ignoring what are scientific principles. How do you think healthcare workers are going to react to this?
It's funny, when I speak with my colleagues about this, it's very interesting to speak to people in the medical field and people in the non-medical field, because you're almost talking as if we're viewing the situation completely differently. People in the medical field still talk about coronavirus as if it's still going on, as if it's going to be a threat for at least another year, and that we have to keep doing all the stuff we've been talking about limiting our social interactions, and it makes complete sense to us. And then I speak to people who are not in the medical field, and they're behaving as if nothing happened. And it's truly baffling to me. We had, a little bit over 8,000 deaths in this country. You were talking before, the number of deaths, 500,000 deaths worldwide. It's incredible that this thing happened, and it didn't really leave a mark on the public consciousness in any significant way. There's a lot of people who are behaving as this never happened. And it's really it's baffling to me. It's a little bit frustrating to me. And it's really incredible because, if there's a message that I try to get to people that I really want them to understand is that, these social restrictions are not so much about protecting you. You yourself as an individual, if you're young and healthy, you're probably going to be okay. It's the people you spread the virus to, because these people, especially if they're older, especially if they have health conditions, they may get sick, they may get very sick, they may be in hospital, and, they may die. And you have to remember that being in a hospital with coronavirus is actually terrible, because not only are you in hospital, but you're alone. You can't have visitors. You can't have people come to visit you. It's a terrible thing to have happen to a human being. And I think we need to be a little bit more conscious about that and just really try to bang home into people's heads that this is still a problem and this is still something we need to be worried about.
Frustrating, you use that word. Do you ever foresee a time, not necessarily in Canada, but just maybe in the States right now, given what's happening, where people, where doctors, where nurses, where other healthcare professionals say, you know what, I'm just not going to put my life on the line for you in this way, in this current context, if you're just going to continue to ignore the rules and flout them?
I think it could happen. I think, especially if the hospital systems become overwhelmed, there is a capacity. The system in New York came, fairly close to breaking down. So, if there's a second wave that's just as bad or worse than the first, that could certainly happen. At a certain point, the healthcare systems can only do what their capacity allows them to do. So if there's too many cases, there just may be a time when there's just not enough room in the hospitals and people just can't get there. And the doctors say, look, we can't do it. If PPE runs out, I don't think you can ever reasonably ask somebody to infect themselves to potentially save someone else. So if there's no PPE, it may come to a point where stuff starts getting triaged. And, we don't like to hear the terms of healthcare rationing or triage, but again, it may come to that if we don't have an appropriate stockpile and if the number of cases just surges beyond our control. So, I don't know what's going to happen. I hope it never comes to that. But we have to remember that if/when the second wave comes, we have to remember that it may be necessary for us to sacrifice again, and not sacrifice for ourselves, sacrifice for other people. And I think I want to get people to start thinking about this in a selfless way, not in a selfish way.
Well, I am so glad, because I've been thinking about this and how healthcare professionals may respond to people who perhaps refuse to change their behavior or follow what we're supposed to do as a society. Thank you for weighing in on that. I feel a lot better, and I can say I'll see you again soon. Come on back and we'll talk about the latest science and research and viewer questions with you, as we often do. Thank you, Dr. Labos.
My pleasure. Take care.